All right, Dr. Andrew Grecki here. Let me ask you something. You've probably never been asked in a Con Ed course, what percentage of your patients actually do their home exercise program? How many people know that, right? Not how many say they do it, but how many people actually do it? Do you know the answer to that? I bet you don't. I didn't. I can tell you that studies suggest it's somewhere between 35 to 40%, which means that for every 10 patients that you discharge, six of them didn't consistently do their home exercises while they were with you. And that's not a judgment on your patients. It's a structural problem with how we deliver physical therapy or occupational therapy or speech therapy. And RTM really changes that. Not because it nags patients, because it supports them in a way that actually works, right? Let me show you what I mean. I want to give you some examples. And again, I'm a practice owner. I'm the owner of MovementRX as well, helping hundreds of practices around the country with RTM, but I've got a lot of experience here doing this in my own clinic. I've asked a lot of patients over the years why they didn't do their exercises, right? And the answers are almost always the same. Oh, I forgot what I was supposed to do, right? I lost a piece of paper, right? They used to give them the VHI. I wasn't sure if I was doing them right. It hurt a little bit and I didn't know, if that was okay or not. Great. I got busy, right? Not laziness, not indifference, but uncertainty and lack of support, right? That's the key. Uncertainty and lack of support. The home exercise program, as traditionally delivered, it asks the patients to carry the entire cognitive and motivational load themselves, right? Here's a printout. See you Thursday. Good luck. Or worse is do it this way, show them, and then they just leave and forget as soon as they get home. We've known for years that this is suboptimal, right? And RTM now gives us a tool to actually fix this problem, right? So let me walk you through what the patient experience looks like with RTM in place. And again, we've had over 7,000 patients go through RTM in my practice and hundreds of thousands in my software with other practices. But the patient finishes their session, right? Instead of leaving with a printout or they may or may not look at again in a folder, maybe you gave them, maybe you didn't. They leave with their exercises already loaded in the app that's on their phone. It's a video. Their exercises are on a video on their phone. It's demonstrated by their physical therapist or pulled from a library that was already filmed with specific notes for their case. So now between visits, the app prompts them to log their exercises, right? They watch their video. They do the movement. They report how it felt. If something's off, right, pain that's higher than expected, an exercise they can't perform, maybe they have confusion about the technique, that information comes to our monitoring team through the app. The patient can actually send a message, right, through the app to a provider, a licensed provider who reviews and follows up. That close the loop, right? The patient reports, clinician reviews, clinician responds. That's what changes behavior of the patient, right? They know somebody's there who cares. One of our patients told us she had been to PT twice. I think she even wrote this on Google. And she quit both times before finishing, right? With RTM, she completed the full program for the first time. And her words were something like, someone was actually paying attention. And again, you can read this in our Google reviews. My practice is called Superior Physical Therapy in Michigan. But here's what happens, right? Downstream, when patients actually do exercises, they do their home treatment plans, they progress faster, which means better outcomes at discharge. They complete their full plan of care at higher rates because they're seeing the benefits of what you're giving them, which means the dropout is less. There's fewer awkward conversations. There's better retention numbers. And they're crediting their physical therapist with the outcome, right? That's important, which means more referrals, more reviews, more word of mouth, right? And your providers feel better because they went into this profession to help people get better, right? When they see patients actually doing the work and making progress, that's energizing. That's energizing to a provider, right? In a field with serious burnout issues, I think that matters a ton, right? I think that matters a ton. RTM didn't change the clinical approach. It didn't change anything your providers do. It changed the infrastructure around the clinical approach, right? And that infrastructure change turned into a problem we'd all accept it as normal. Poor home exercise compliance, right? And it changed it into something we could actually solve, right? We're solving that problem. This is a really huge opportunity for our profession. So I want to briefly address the implementation question because I know it's on your mind, right? Getting RTM running in your practice is not a 6-month project. It's not a major staff overhaul like changing an EMR. It's not a compliance nightmare. The core setup literally takes a few weeks, right? Staff training is hours. And most staff, they respond positively, right? Because it gives them patients that get better outcomes, better tools without adding more to the clinical team's plate. They don't have documentation to do. Our system tracks all that. The monitoring is handled by our remote PTAs or CODAs. Your team isn't fielding after-hour messages. They're not documenting anything for this. They don't have to. It's all in our system. They're not drowning in app notifications. They're doing exactly what they were already doing, which is seeing patients, running great sessions, recording a home exercise program using software, and the system runs in the background and makes those sessions more effective. That's it. That's it. I mean, that's about as simple as I can make it. If poor HEP compliance has been a frustration in your practice, which it is for everybody. And I've never met a PT who it isn't been, right? RTM is worth a real look, not because it's magic, but because it solves the actual problem. Patients feel supported. They do the work. There's accountability. They get better, right? I want you to book a 15-minute call with me if you've gotten this far in the video. The link's in the description of this video. I'm happy to walk you through the process and answer any questions you have. I hope you enjoyed this video as much as I enjoyed making it. I'll see you next time.